everyone, I'm Dr. Wen Long Huang, a general surgeon from the first affiliate hospital of Shantou University Medical College. In the last session, we talked about mechanical digestion. And in these classes, we will discuss chemical digestion and absorption. At the end of this session, you will be able to differentiate two types of chemical digestion and describe the process of protein, carbohydrate, and fat digestion and absorption, as well as mineral, vitamins, and water absorption. And let's start off with a case. Fang Fang, a 7-year-old boy, came to the emergency room with recurrent abdominal pain and diarrhea for 2 weeks. He started to drink milk provided by the school 2 weeks ago. The abdominal pain occurs 1 hour after the milk consumption, followed by the diarrhea. Question for you: what may be the potential cause for Fang Fang's symptoms? We'll try to answer this question by discussing chemical digestion and absorption. Chemical digestion refers to the breakdown of food particles by different digestive juices containing enzymes into subunits which are absorbed through the mucosa of the small intestine. This process can happen either in the lumen of the GI tract or on the surface of the intestinal mucosa. Absorption. Absorption is the transport of solute and water from the gut lumen across the intestinal epithelium into the lymphatic system or the venous blood. There are mainly 3 ways of absorption: the passive diffusion, facilitative diffusion, and active transport. Passive diffusion. Water and water-soluble substances cross cell membrane, damp the concentration gradient, whereas facilitative diffusion needs the help of transmembrane proteins. And in active transport, molecules are transported from a lower concentration to a higher concentration, which requires transmembrane proteins and energy. Next, let's look at how carbohydrates, proteins, and fats are digested and absorbed. Carbohydrate digestion and absorption. The digestion of carbohydrate begins in the mouth with salivary alpha amylase. Majority of the carbohydrate digestion takes place in the lumen of the small intestine using pancreatic alpha amylase. This is a highly active enzyme that cleaves complex carbohydrate into lactose, sucrose, maltose, etc. The final digestion of carbohydrates is complete by the enzymes on the brush border of intestinal mucosa cells. And glucose is absorbed by the secondary active transport with sodium ion into the capillaries. Protein digestion and absorption. In the acidic gastric environment, pepsinogen secreted by the chief cells is converted to its active form, the pepsin. The pepsin breaks down proteins into peptides. And in the duodenum, trypsinogen and chymotrypsinogen are activated by enterokinase into trypsin and chymotrypsin. The 2 proteins hydrolyze protein into polypeptides and further into smaller peptides. The above process of chemical digestion takes place in the lumen, so we call this luminal digestion. And the final digestion of peptides into amino acids is by the peptidase on the surface of small intestinal epithelial cells, which we call membrane digestion. Absorption of peptides and amino acids is similar to that of glucose. Fat digestion and absorption. In the small intestine, bile emulsifies the lipids into small fat droplets. The pancreatic lipids and cholipids break down the emulsified fat to monoglyceride and fatty acids stored in the micelles. The monoglycerides and fatty acids move out of the micelles and into the cells by passive diffusion, whereas the cholesterol enters cells by a transmembrane protein. The absorbed fats, cholesterol, and proteins together form chylomicrons, which are absorbed by the GI lymphatic system. Absorption of sodium ion, chloride ion, and bicarbonate. The sodium-hydrogen exchanger presents in the brush border of the small intestine and colonic cells is the major mechanism of sodium absorption. The sodium-potassium ATPase is located exclusively on the basolateral membrane, responsible for active transport of sodium ion from the epithelial intestinal cells to the capillary. Water absorption. 95% of water is absorbed in the small intestine by osmosis. Water uptake is coupled with solute uptake, and water moves into the mucosal cells, and substances follow along their concentration gradient. Calcium absorption. Calcium ions are actively absorbed throughout the small intestine, especially in the duodenum. The calcium binding protein is an essential component of calcium ion absorption. Its synthesis is stimulated by the hormonal vitamin D. On the basolateral cell membrane, two proteins are responsible for the absorption of the calcium ion against its electrochemical gradient. The calcium ion ATPase in the basolateral membrane is the primary transport protein that splits APP and uses the energy to transport calcium ion. The sodium-calcium exchanger uses this energy of the sodium ion gradient to exude calcium ion by active transport. When there is a vitamin D deficiency or lack of adequate calcium in the diet, children may develop rickets. Rickets is a softening of the bones in the children, potentially leading to the fractures and deformity. Higher risk for developing rickets include inadequate sun exposure. Absorption of iron is mainly through the active transport by transferrin TF. Iron is better absorbed in its ferrous rather than its ferric form. Vitamin C, hydrogen chloride, and the liver hormone hepcidin are all involved in iron absorption. Absorption of vitamins. Vitamins are essential organic compounds not synthesized by the body. They can be divided into fat-soluble vitamins, for example, vitamin A, D, E, and K, which are absorbed together with fats in forms of micelles or chylomicrons, and water-soluble vitamins, the vitamin B1, B2, B6, B12, folic acid, vitamin C, vitamin K. All these vitamins are absorbed through the active transport. Absorption of vitamin B12 occurs mainly in the lower half of the small intestine and requires intrinsic factor. Now, let's come back to the case. Fang Fang may have lactose intolerance, which is caused by the lack of lactase. The lactose in the milk is not digested, resulting in osmotic diarrhea. The spasm of the gastrointestinal tract accounts for his abdominal pain. Summary. So in this class, we have discussed different types of chemical digestion. We have also gone through the digestion and absorption of carbohydrate, protein, and fat, and also the absorption of minerals, vitamins, and water. And that's all for GI physiology in this course. Thank you.